My name is Disha Shukla. I'm 21 years old. Today's date is June 28th of 2017, and I'm speaking with Dr. Rajnikant Shah, who is my father. And we are recording via FaceTime from Huntington, West Virginia to Beckley, West Virginia. So my first question, Dad, is our first year seminar class is focused on critical thinking. What is an example of critical thinking you have used in your line of work or that you have used in your life?
Well, talking about my own profession, and I'm a surgeon by training and practice. If a patient comes to me with any complaints, I have to evaluate to establish diagnosis, and there are X number of thinking that comes to my mind, and I have to select the best. Then, when it comes to operation, sometimes unexpected things you found, unexpected situation you found out while you are operating, and you have to have quick thinking what can be done best so the patient can be functional physiologically and his anatomy is restored.
Okay, so now moving on. What made you become a physician and at what age did you know?
Well, at the age of 16, I lost my aunt of stomach cancer. I was already afflicted with left leg polio. It was difficult for me to walk, but that was the time that I made up my mind that I should strive to go to medical school.
Okay, so has this always been a dream career or did you want to do something different before the age of 16?
No, this was a dream career. The other alternative was to become a locomotive engineer and run the trains.
Okay, anything about maybe being a pilot?
Well, it crossed my mind. I was been always avidly interested in aviation, and in Africa you could not get that good chance, nor in India. But coming to America, there was enormous opportunity. But being the only brother, my sisters prevented me to enrolling for any pilot training.
Okay, so what was your biggest obstacle throughout medical school?
In medical school, I did not find any obstacle per se because I was humble enough to learn from my professors, my colleagues, and they were in a way very empathetic. But I could walk freely, and I do not recall any serious obstacle in my work.
Aside from having childhood polio, right?
Yes.
Okay. So now, can you describe how you handled any sort of like emergencies and how you dealt with the stress of the workload of being a physician?
Well, when I was in first year surgical training, I learned from my professors, my superiors, my colleagues, how to think, how to organize, and I was expected to run to the emergency room as fast as anybody could. They did not think whether I could walk or run. They did not think anything. I was expected to be present when I was needed, even on the floor, in operating room, and I pay tribute to my professors who were extremely empathetic, inspiring, and they devoted themselves to such an extent that they made a surgeon out of me.
Okay. So, why did you choose to specialize in general surgery?
Well, general surgery, unlike any other discipline in medicine, it certainly makes you think very critically what you can do, how you can be innovative sometimes in the operating room, how to establish the diagnosis, and it gives you chance to operate on several parts of the body except brain, ear, nose, throat, and eyes,
So,
and heart.
do you think that because your aunt had stomach cancer, that this is why you wanted to do general surgery?
That was one of the reasons.
Okay. So, moving on, what exactly made you want to come to Beckley, West Virginia and settle
Well,
down?
in North Carolina, I found the summer oppressively hot. Beckley had a suitable salubrious climate, just like where I grew up in Africa, where most of the cities are at a height of more than 3,000 feet above the sea level.
So, where did you do your residency at?
At Appalachian Regional Hospital, Beckley, West Virginia.
So, how were you recruited to Beckley?
I was told by a professor in North Carolina when I said that I cannot live in North Carolina with this oppressive heat of summer. He said there is a nice small city in West Virginia where the physical plant is not that great, but there are great thinkers who were trained in Harvard, and you will have a lot of freedom to do the surgery under their eyes. And that was very true. In Beckley, when I came here, I had done in first year 19 gallbladder surgery, which I could not do until third year in North Carolina.
Okay. So, how long have you been practicing medicine? And what?
On my own in private practice, I uh, was actively practicing surgery in the hospital and the office for 30, I think, yeah, 37 years. And because I developed weakness in my muscles due to post-polio syndrome, I gave it up at the height of my career when I was chief of staff, chief of surgery, and I became a senior consultant in my office and also medical director serving two hospitals.
And you're still doing that, correct?
Yes.
Okay. So, what would you consider to be your biggest strength and weakness?
The biggest strength was that I was so well trained that I could do most of the operations from neck down to feet, whether it was vascular, cancer of the breast, cancer of the colon, gallbladder, carpal tunnel syndrome, varieties of surgeries that I have touched upon.
So, do you have what would you consider to be a weakness of yours?
Well, weakness comes when you cannot think hard to establish the diagnosis and to be innovative in surgery.
Okay. And your biggest,
But I did not find that weakness because I was quite accomplished in what I did.
so what is your biggest achievement to this date?
Well, being chief of surgery at 4 hospitals, medical directors at 2 hospitals, chief of, and uh, that is my biggest achievement.
Okay. So, if you wouldn't mind to tell us one of your coolest stories from being a physician for this many years.
Well, I was in a small hospital about 35 miles from Beckley. There was one night there was 14 inches of snow in midwinter, and I was called by emergency room doctor that there is a newborn, recently newborn, came with a distended abdomen and wanted me to come and see. I walked in 100 yards in 14 inches of snow, evaluated the patient, looked at the x-ray, and I thought that this infant had perforation of one of the organs of the abdomen. So I tried to make arrangement for the infant to go to Children's Hospital, which was about 80 miles away, but no ambulance will take. I could not arrange for helicopter because it could not land. So I thought about larger hospital than where I was, but ambulance could not take the baby there because of a lot of snow. So I mustered my strength and I said, this baby cannot suffer like this. I took to the operating room with nurse anesthetist, one circulator and one scrub. I opened the belly, found a perforated ulcer. I washed the abdomen. After I repaired the ulcer with a couple of stitches and put a patch of omentum to seal it, and then washed the belly and closed it. The baby survived, did well. 10 years later on, he came to see me with his mother for something else. And his mother asked me whether I remembered this kid when he was infant. When she said when this boy was infant, it at once stuck into my mind that yes, I repaired his perforated ulcer. And he was doing well.
That's awesome. So, just a few more questions. As your daughter, studying to follow in your footsteps, what advice would you give me for when things start to get difficult and I become discouraged?
Study hard, be humble to your colleagues, first of all to your patients, then to your colleagues, and certainly least but not last but not least, your professors. Have empathy for these people and making sure that you are there to make them feel better than what they came to you for.
Okay. So, as we wrap things up, is there anything that you would like to add that I haven't asked?
Well, what can I say? I just want one thing, that you have excellent personality and you have always been good girl since your childhood, and I'm proud of you.